Welcome to the explainer. The white of your eye is so much more than just a backdrop. It's a tough, protective armor called the sclera. Today, we're going to explore what happens when this biological armor fails, from really dangerous inflammation to, believe it or not, structural collapse. Let's get right into it.
All right, so here's our roadmap. We'll kick things off with a quick look at what the sclera actually is. Then we get into the main event, inflammation, also known as scleritis, and we'll break down the different types. After that, we'll check out what happens when the sclera gets weak, and finally, we'll wrap it all up with why this is so critical, not just for eye health, but for our health overall.
So, before we jump into all the problems, let's just take a second to understand the design. What exactly is this protective shell, and what's its big role in the eye's anatomy? Think of the sclera as the main chassis of the eyeball. Our source material calls it the tough, opaque, fibrous coat that makes up about 5/6 of the eye's surface. It's literally the white of your eye, and its job is to provide this strong, protective shell that keeps the eye's shape and shields all the delicate stuff inside. And that clear part you see through, the cornea, it's set right into the front of it, almost like the crystal on a watch. Okay, so what happens when this protective armor runs into trouble? Well, the most common issue by far is inflammation, which is a really serious condition we call scleritis. Now, this is pretty interesting. How do we categorize scleritis? Well, it's all about location, location, location. A whopping 90% of cases are anterior scleritis. That means the inflammation is in the front part of the sclera, the part you can actually see. The other 10%, that's posterior scleritis, happening way in the back, behind the eye's equator, which makes it a whole lot harder to spot. So let's focus on that more common type, anterior scleritis, and see how it breaks down into different forms. This isn't just one single condition. It's more like a spectrum that ranges in how severe it can be. So anterior scleritis basically splits down two very different roads. On one hand, you've got the non-necrotizing type. That's inflammation, sure, but without any tissue actually dying. But on the other path, you have the far, far more dangerous necrotizing form, where the inflammation is so aggressive it literally starts to destroy the sclera itself. Within that really severe category, there are a couple of variations. The first one is pretty much what you'd expect, necrotizing scleritis with inflammation. This is the version that basically screams for attention through intense pain and very obvious redness. And this really shows you just how aggressive this condition is. The inflammation can get so intense that it chokes off the blood supply. That's a process called infarction, which leads to tissue death. As the sclera dies off, it gets thinner and thinner, sometimes becoming so transparent that you can actually see the darker tissue underneath, the uvea. It's a huge warning sign that the eye's structure is failing. But then there's this other, much sneakier form of necrotizing scleritis, one that happens without those classic, painful warning signs of an acute inflammation. It's called Scleromalacia perforans, and what makes it so insidious is that it's strongly linked to rheumatoid arthritis, but it doesn't cause that fiery pain. Instead, the sclera just kind of dissolves. It thins and melts away without any real warning. It's a pretty chilling example of how an autoimmune disease can just silently destroy the body's own defenses. All right, let's move to the back of the eye and talk about that rarer 10% of cases, posterior scleritis. Because it's hidden from plain sight, it presents a totally different kind of challenge. And this quote from our source really gets to the heart of it. It's just a tricky diagnosis. The signs aren't obvious, like a red, painful eye. The symptoms can actually mimic a lot of other conditions, which can lead clinicians down the completely wrong path if they aren't super careful. So if you can't see the inflammation directly, how in the world is it diagnosed? Well, by looking for collateral damage. The inflammation starts to spread to its neighbors. So doctors look for clues, things like fluid leaking and causing the retina to detach, or swelling in the macula. That's the part of your retina you need for sharp central vision. These secondary problems are like the breadcrumbs that lead back to the real hidden issue in the sclera. Okay, so moving away from inflammation for a second, the sclera can also have structural failures. When it gets severely thinned out and weak, it can lead to something called a staphyloma. So a staphyloma is basically an outward bulge of the eye's wall. It happens in a spot where the sclera has gotten so weak that it just can't handle the normal internal pressure of the eye anymore. And the darker tissue underneath, the uveal tissue, pushes right through, creating a bulge you can see.
And just like we saw with scleritis, location is absolutely key here. The classification basically follows a path from the front of the eye all the way to the back. It starts with an intercalary staphyloma, right at the border of the cornea. Then moving back, you get the ciliary type, then the equatorial, right at the eye's midline, and finally the posterior staphyloma, which is hidden at the very back of the eye.
So we've talked about inflammation that attacks the sclera and weakness that causes it to bulge out. But what's the big picture here? Why should we pay such close attention to diseases of the eye's outer shell?
Well, the really crucial point is that scleral diseases are hardly ever just about the eye. That strong link between the necrotizing types and autoimmune disorders means the eye is often acting like a canary in a coal mine for a body-wide problem. You add that to the diagnostic puzzle of posterior scleritis and the serious structural threat from both inflammation and staphylomas, and you really start to see how critical it is to understand these conditions.
And this really leaves us with a final thought. The sclera is designed to be the eye's armor, right? To protect it from the outside world. But what these diseases show us is what can happen when the biggest threat actually comes from within, when the body's own immune system turns against its protector. It's a really powerful reminder of the delicate balance that's required to maintain not just our vision, but our overall health.